What if you couldn't walk because of joint pain? What if you couldn't run because the moment you did, you didn't have the energy to continue? And what if nobody believed you when you claimed to be ill? The immune system consists of many different types of white blood cells and tissues that work together to target and destroy foreign invaders. A special type of white blood cell produces proteins, known as antibodies, which mark invaders for destruction. But what happens when the body mistakenly targets its own cells?
My name's Chang Nguyen. I actually have lupus. I have systemic lupus, and I also have end-stage kidney disease, kidney failure.
Lupus is an autoimmune disease which causes inflammation and permanent damage to body tissues and organs. It most commonly affects the joints, skin, and kidneys, often causing kidney failure in its later stages. However, although it is passed genetically, the onset of the disease often does not occur until later in life.
Lupus comes on usually when the body changes hormone levels. So for me, it happened when I was like 12 years old. I had a rash on my face. It's called a butterfly rash. But at the time when I was diagnosed, it was kind of a rare disease. It wasn't very well known. And most doctors didn't know about it, haven't heard about it, none of that stuff. So it was very difficult to get diagnosed. Everybody knows about cancer. I mean, there are more people now know that lupus exists, and then still don't understand. They don't know how it's treated, how it's taken care of, how it actually affects people, and they don't know that it usually affects them internally.
Internally, aside from the butterfly rash, lupus has few other visible symptoms. The majority of the symptoms lie internally. These symptoms can range from being merely annoying to being life-threatening. But what are some of these symptoms? And what makes them so dangerous?
It doesn't hit you like a truck all at once. It slowly affects you. Because it's so gradual, yeah, you kind of don't notice it until it actually hits you, and usually you won't notice until after you have had it for a while, and like something actually happens and you get hospitalized or something. So, I could be missing a few limbs, like a lot of the other dialysis patients are. I could be in a wheelchair. Um, right now I'm walking on my own. I don't need any assistance with getting, taking a shower, putting on my clothes, um, bald. Lupus affects pretty much all the organs and everything in your body, which includes your skin, just everything. And it wears out your organs a lot quicker than just an average person. So, like for me, I've had it for over 30 years. And my organs are like somebody of an 80-year-old person. Lupus slowly shuts down your system pretty much. The first organ that it tends to shut down is the kidneys, which has happened to me. It started affecting my kidneys when I was 14 years old. And now I'm 44 and I've been on dialysis for 2 years. Lupus makes you very tired. It affects your joints, so it makes it hard to move around. It wears down your joints a lot, so a lot of times it's painful to move around. Um, so pretty much I have not been working for a while. Dialysis is pretty much a full-time job. So most people are in dialysis at least 3 times a week, which I am 3 times a week. And from start to finish, it's close to 4 hours each treatment. And that's normal. Some people are actually in there for like 6 hours. Dialysis is extremely draining. There are times where after dialysis, I just sleep all day.
When the kidneys fail, it becomes necessary for the affected person to be put on dialysis to remove waste, salt, and extra water from the body. Now, knowing one of the harsher symptoms of lupus, kidney failure, how can the personal life of the victim be affected?
Family helps to, make sure I have the things I need. I think a lot of my family still does not understand what I have. They know that I have something, but they don't understand what I have. And I think the problem, and it's the same with everybody else, they're like, well, you don't look sick. You look fine. My circle is rather limited because I don't go out that much with other people. Because I do have anxiety, and because my immune system is pretty much non-existent, I'm not around a lot of people just so that I don't catch something. If I got the disease when I was older and I've had a life, that's different, but I've pretty much had it my entire life. So this is the only life that I know.
Unsurprisingly, this has had a large emotional impact on Trang's life. Her anxiety likely being caused somewhat by her reduced social interaction and much frustration when close family don't even understand her condition. One of the biggest issues of lupus isn't the symptoms it causes or how it affects its victims. One of the biggest issues is awareness.
It's still a pretty young disease. There's still not as much information on it, not as much research on it. Doctors in that field are still slowly trying to get enough funding to do research, to gather information from other patients. There just needs to be a lot more research with it and a lot more funding too. By the way, lupus is not contagious. You can't give it to anybody else. But so unless there's more research done on it, and of course with research you need money, and right now patients like me, we just have to use the medication that is there. There's no specific medication designed for lupus. We're just using medication from for other things to help manage the symptoms that we have, and that's pretty much it. People who have lupus, they don't look like they're sick. So if they're not, if they don't want to go out, or if they say they're tired because or something hurts, or it's not somebody trying to be dramatic about something, or somebody just trying to be lazy or something. It's because they really don't have the energy to do something. And a lot of people who have lupus have anxiety, and they have depression, and that affects a lot of the things that you do. When physically you're limited to things that normal people can do, it affects you emotionally.